Welcome everyone to Disability Life TV. We're so happy that you joined us today. We're going to talk about phoenixes rising from the ashes. We're going to talk about sight impairment. We're going to talk about community engagement. In fact, just tune in and you'll see exactly what we'll be talking about today on Disability Life TV.
Disability Life TV is sponsored by Connor Dental Associates.
Today on Disability Life TV, we have Dr. Ernest Hopkins. That's right, Dr. Ernest Hopkins has a lot going on. He's not just a doctor, he's also a minister, a community leader, and a friend. So join me today as we discuss community involvement. How do you activate your life, your community, your neighborhood, and the places where you make impact? So thank you so much, Dr. Hopkins, for joining us today. How are you?
I'm fine. I'm glad to be here.
I'm glad to have you here. It's been a while. We've been trying really hard to get you on the show.
Yes.
So I'm really glad that you were able to come today. But more than that, I'd like to introduce you to the Disability Life TV viewers. And I'd like to do that by talking a little bit about your humble beginnings. Tell me about where you grew up.
So I'm originally from Washington, D.C., lived several years in the Baltimore, Washington metropolitan area, moved to the Atlanta metro area in 1997. So at this point, I'm now from Georgia.
How long has it been? How long have you been in the state of Georgia?
It's been about 15 years.
Okay, so he's officially a peach, basically, right? Fuzzy, peachy,
Yes, yeah.
Good. So I'd like to talk a little bit about your invisible disability. Now, most people looking at him directly probably say, excuse me, Dr. Hopkins, disability, is that possible? Let's talk a little bit about that. Do you mind sharing with the audience?
Not at all. So I am a person living with a disability. My disability is that I'm visually impaired. And so for me, I've lived with an invisible disability most of my life, except for when I was 5 years old.
What happened at 5 years old? So you weren't born with a disability?
So I wasn't born with a disability. Okay. Actually, it actually is, I'm a victim of child abuse.
Wow.
Yeah.
Let's pause for that.
Yeah.
Okay.
Sure.
Are you comfortable talking about that?
I'm absolutely
You're helping a lot of people, so I appreciate that.
Yeah.
So let's talk about what happened at the age of 5.
At the age of 5, I was a child that was brutally abused by my mom.
Okay.
And at that time, it's in the 60s.
Wow, the 60s. See,
so
I wouldn't have told
so
my age.
Child abuse wasn't.
It wasn't considered abuse.
It wasn't even considered abuse.
Yeah, it was discipline.
And then PTSD. If your mom had PTSD, it wasn't really out there as far as something that people were really talking about.
Okay.
It is believed that she suffered PTSD, and I was the firstborn, and I was terribly, brutally abused as a kid.
Got it.
And so at the age of 5 years old, my mother actually stuck scissors in my eyes. And I was 5 years old, and I was able to get out by knowing that my heroes were firemen.
Oh, wow.
In firehouses. What brings a fireman to your house?
An emergency? A fire?
A fire.
A fire.
And I was a kid, I was actually a kid that was locked up in closets. And the only way that I knew how to get out of the closet was set the closet on fire. And so at the time I was 5 years old, the fire department came, and at that point I was made a ward of the court in the District of Columbia. This is Washington, D.C.
Okay.
And this is probably around 1968, so a lot's going on in Washington, D.C.
Wow.
And so I was made a ward of the court, and I was a ward of the court until I was 21 years of age. But I basically went to high school at Cardozo High School in Washington, D.C.
Okay.
I went on to Howard University,
Right.
graduated. I would have gone into the military, but of course there was some damage.
Right.
But it has taken many, many years. I'm now the age of 53,
Wow.
but it's taken me many, many years to be able to have this conversation with you about how people become physically disabled, or some people, not everybody.
Right.
Mine was physical abuse or child abuse.
Right.
And I'm not afraid to talk about it.
I appreciate that. No.
Very much.
So
Sure.
sorry for your beginnings, but I'm so excited that you have more than overcome. So I'd like to know a little bit about the point in which you realized that you were sight impaired, or you identified with a visual impairment, which used to be called blind, and the degrees of blindness, because there are several degrees of blindness. So obviously you can see my hand, but how you see my hand really does identify the measure and degree of blindness. And I think that's important for people to understand, because usually you say, I'm legally blind. And the impression is that you use a white cane or that you need a seeing eye dog, which in your case is neither. Am I correct?
That's correct.
So would you help the audience understand?
So for a long time in my life, I as I mentioned, I'm now 53. Most of my life, I just never considered myself handicapped.
Which is what they used to call it.
And so I went many years operating as a person that I thought, or as a normal, what I thought was the normal community.
Right.
As I got into junior high school, that's when I realized that there was a disability. And at the time, special needs
Yes.
was just starting to take shape in the educational system.
Wow.
In Washington, D.C., they finally realized that there were students that had disabilities, and so there were special needs classes for people.
Okay.
So when I realized I needed help was when I had to request for a large print.
Wow. Okay.
And so when I needed large print, then I knew, okay, well, I have some eye problems. I need to, as a young person, get beyond being proud.
Wow.
And feel free to just simply say, I can't see this. Is there a way to enlarge this? So I've gotten better over the years. As I've gotten older, I will say I always have to practice that thought process.
Right.
Because you always have to advocate for what your needs are.
Right.
And what your accommodations are. And so, yeah.
I love that you mentioned that, because you're pre-ADA. In other words, your disability occurred before the Americans with Disabilities
Sure.
Act was enacted.
Yes.
So there wasn't all of these acquisitions and support systems and different processes in place in the classrooms or even in the workplace for people with disabilities in 60s and early 70s, because again, as Dr. Hopkins mentioned, they were called handicap. We'll talk about the history of what hand and cap really means, but for the purpose of this episode, we'd like to focus on Dr. Hopkins and your transition into manhood. And it sounds like that happened a lot earlier than you're
Yes.
giving away, right?
Yes. Oh, yes.
Because as difficult as it might have been for you to deal with your abuse, you now have to identify as someone with a disability, which can be very difficult in the school systems especially. So can we talk a little bit about that? How was your school life and your friends and the people who may have recognized that there was something a little different about you? I call it special, not special needs, but amazingly special.
Yeah.
But let's go back to junior high and tell me a little bit
my.
about that.
Wow. So I in Washington, D.C., there's a school called Shaw Junior High School, and at the time, there weren't very many special needs, or at least identified special needs.
That's a good point.
And so I was the kid that had to see things like, nearsighted up close,
Right.
and why did he have to have things enlarged, and was I teased by kids? Yes. And then I remember times when I just needed to be able to navigate through the building, and it was Shaw Junior High School, and for persons that are in know of the Washington, D.C. area, it's one of the more modern, or at least at that time, it was one of the more modern schools.
Okay.
It was one of the schools that was without walls, and so classes were over here, classes were over there. It was hard for me to navigate in the older building because of my vision.
Okay.
And so I remember just wanting to be able to navigate from one room to the next room to my next class to the next class. The bell rang.
Wow.
You know, you've got less than 5 minutes to get to your next class, and then
Right.
trying to see the room number.
Yes.
Those were some of my experiences.
Okay.
Yeah.
So it doesn't sound like there was a lot of bullying.
No.
Okay. Because you have an invisible disability, it wasn't something that could easily be attacked. Am I correct in saying that?
Exactly, yes.
So help me understand then. After you graduated from high school, I understood you were a very young entrepreneur.
I was.
Okay.
I owned a transportation company.
Okay.
I had 3 motor coaches. My
Okay.
church, if you know the Washington, D.C. area, there's a place called King's Dominion, and then there's Busch Gardens.
Yes.
Then there's, to the north is Pennsylvania, and there's the Pennsylvania, I think it's called the Poconos.
Oh.
There's the
Yes.
under caverns.
Yes.
So my church used to go like almost every other weekend, and I said I needed to captivate my church and help my church. So I was 16 or 17 years old, and I had my own motor coach company, and the way that I did it was I used people who were much older than me,
Right.
and I was president of the company, but to get to where I needed to acquire the coaches, I just used other people that were 21, 55, my aunt, my uncle,
Wow.
and I ran the company for about 2 years.
Okay. And was your brother helping you? At
My
that point?
brother was helping me, and then
Okay.
he wanted to become an executive chef to a restaurant, so we did that.
Can we take pause for a moment?
Yeah.
He can cook. He is a really good cook. So the fact that your brother wanted to be an executive chef and that he's so good at cooking, I just had to get that out. So, how long did you have your business?
For my transportation business lasted about 2.5 years, not quite 3 years.
Wow.
I had to learn some things the hard way, which was I was identifying that I'm a person living with a disability, and
Right.
then I realized buses cost money,
Yes.
and then there's something called maintenance.
Yes.
And so if you've got a group of 55 people on a motor coach and you can't pay for the flat tire that's like 500 miles outside of town,
Yes.
you have a problem.
Got it.
And so I learned stuff like that the hard way, and my brother went on to school, actually went to France to become an executive chef, and then I learned the hard lessons that you need to be able to pay for those bus tires,
Oh, yeah.
and engine maintenance, and insurance, and payroll, and it just went on. So eventually, my dream was to compete with a company called Gold Line in Washington, D.C.
Oh, okay.
They're huge. Well, they were huge at the time, and
Okay.
I eventually veered into other business projects, and sort of the bank
Supported your projects.
the bank supported my projects.
That's pretty
and-
exciting.
Yeah.
That's
yeah.
pretty exciting. And I just wanted to bring up that point because you talk about navigating through life and
Yeah.
finding things out the hard way. But isn't that how you started out? You
the
found
very
things
beginning,
out
yes.
the hard
Yeah,
way.
yeah.
So when we look back and say, wow, I mean, it took me everything I had to hold back tears because I hadn't heard the depth of the origin of Dr. Hopkins' childhood. But what I'd like to touch on before we go into the break is how is your relationship today with your mom?
Wow. It's on and off. My mother is 16 years older than me, so
Wow.
she could almost be my elder sister.
Right.
But it is very good. We don't communicate as much as we should. And it's because I am busy,
Right.
and I guess because I wasn't raised with her. I
Right.
was raised by a wealthy aunt,
Okay.
that kind of took on being the foster parent.
Oh, what a blessing.
And the foster parent basically trained me that education was going to be important, and that you can overcome, at the time she used the word handicap,
Right.
that I was greater than the handicap, and that I could
Wow.
overcome the handicap, continue to
Like that.
educate myself. And she said, as long as you speak well,
Which he does.
you would automatically overcome any obstacles. And so I was always taught to speak well, write well, and listen. And so I just got good at doing that. And and being able to hear people and listen. So.
I know you're as captivated as I am. This has been, it's just been a very quick first half of our show, but we do need to break for our sponsors. And I would like my guests to just recover and refresh with water provided by O'Charlie's. We're excited about that, and we invite you to sponsor us, to have your advertisements on our show, and to help us support people like Dr. Hopkins and others who are joining us. So hold on tight. We'll be right back.
Connor Dental Associates, full-service dentistry, providing orthodontics, implants, laser dentistry, and general care, set in a calm and relaxing environment. Our experienced dentist and staff are here to maintain your dental health, improve your appearance and quality of life. Compassionate, professional, and informative. Ask about our core whitening system, servicing insured and non-insured patients of all ages. Located in Kennesaw, near I-75. Call today and experience the difference for yourself.
Welcome back to Disability Life TV, and let's take a moment to thank my sponsor, Connor Dental and Associates in Kennesaw, Georgia. Thank you so much for sponsoring the show. Before the break, we were talking about Dr. Hopkins. We talked about forgiveness. We didn't say the word, but it was really clear that we had reached that point as an adult, that there is forgiveness and there's growth and there's blessings in the forgiveness. But we also started out talking a little bit about degrees of blindness. So if you could just close out the degree of blindness that you experienced, and then we can move on to the Phoenix group.
Oh, wow. So my degree of blindness is that I am a person living with a disability that is totally blind or have total blindness. So I am 2200, and that I'm a person with a disability, and I do see in the left eye and have no vision in the right eye. But for me, it's total blindness, or at least the federal government considers 2200 to be totally or legally blind.
Right. So there are different levels of blindness, different, as Dr. Hopkins
Partial
mentioned,
blindness.
Partial blindness. So in Dr. Hopkins' case, it's total blindness in the right eye. So consider that when someone tells you that they're blind. There's different degrees.
Oh, yes.
There's different
Yes.
degrees.
Yes.
So let's move on to the Phoenix group.
Oh,
we
my
talked about a
goodness.
phoenix rising from the ashes, and you would think with the first half that we've already discussed that, but there's more.
So
Tell us about
the
Phoenix Group.
Phoenix Group started in 2001. It's a nonprofit 501c3 organization founded around when I first moved here in 1997, and assuming that it's sort of still in that I guess position. The city of Atlanta, the Atlanta metropolitan area, had a high number of HIV statistics, or men who have sex with men. There was a large number of those persons who were living here in the Atlanta metro area. And what I found was that I had a partner who didn't know how to go to his doctor and ask questions.
Wow.
And so I needed to empower my partner that when you went to your doctor, and because the doctor was wearing a white coat, it meant that you did not have to be afraid to ask your doctor, what are my side effects to my medications? And so that prompted me to help him to create the Phoenix Group Foundation, Inc. here in Atlanta Metro.
Wow.
And so we became a HIV nonprofit, prevention, education, and outreach. And then as the years passed, probably in the last 6 years, the organization has changed its mission, so we're not fully dedicated to just HIV prevention education. We've moved on to community engagement, community mobilization, and we've moved on to what's called community-based participatory research, which is the partnership between community people and academia, and merging community and academia. And so in this case, it would be Morehouse, Georgia State University, Georgia Tech, and Kennesaw State, bringing academia closer to the community and wrapping their capability around our health disparities and merging community and academia together, and that's CVPR.
Now, let's talk about high risk. What is high risk, and how do you help the high risk population through the Phoenix Group?
So high-risk populations are communities often of color.
Yes.
And
disability.
or disability community, and it simply means that high-risk persons are persons who can be drug users,
Yes.
can be persons who are misusing drugs or are in need of health or suffering health disparities, persons that are not able to access health care,
Yes.
persons that lack education,
Yes.
resources. And so I like to use the word, and what's very popular in the community is the word underserved.
Yes.
And if someone has, and I know we've had conversations before, I tend to use the word under-resourced.
Exactly.
Under-resourced means that you are still empowered as a community, and underserved to me means that somebody took something from you, you were
right.
robbed of something, and you have been made less than.
Right.
Under-resourced is a little more empowering and sort of changes the demographic,
Right.
the description of what is community and high risk.
And under-resourced is more of a global term.
Yes.
It's not something you've done to yourself,
Yes.
but a limited accessibility to something you need to live.
Yes.
And because we're using under-resourced, it now puts the onus not just on the individual, but the organizations, the community, the government.
Yes.
Because
Very true.
underserved are not people who don't want to get better. They just don't have either the education or access to what they need to get better. So I asked the question specifically around high risk because it's the most common word that's being used. But if you would please consider the word underserved and under-resourced as some of the more progressive words to be used, because they better explain the situation. It's a world that most people will never experience, but it's a world that lives parallel to the world you may live in, and it's important to know your neighbor. We are your neighbors.
Yes.
We are your business owners.
Yes.
We
Yes.
are your TV hosts. So it's important to get to know everyone, and that's why we are so excited that the BizLinks TV network has allowed us to have Disability Life TV and guests like Dr. Ernest Hopkins. Now, you're always doing something. I'd like to expound on what you said earlier to include Morehouse College, which is right here in the city of Atlanta, state of Georgia.
Mm-hmm.
Tell us about your affiliation with Morehouse College.
So in the last couple of years, I'm now the chairman emeritus or chair emeritus to what is the Community Engaged Research Program.
Right.
Again, it's about merging researchers and community together in partnership so that you
Right.
can address issues like health disparities. And health disparities are high blood pressure, diabetes, colorectal cancer. Those are health disparities. And so what was important about that group was getting researchers who were doing research in diabetes or high blood pressure and merging the community with the researcher to address or decrease those health disparities in a high-risk community.
So tell me about CHLP. Did I get that right?
Community Health Leadership Program is a division of the Satcher Health Leadership Institute at Morehouse School of Medicine. I'm a graduate, I'm an alumni, and I graduated in 2012. And I've got to say it changed my life. And if you're out there and you're a community person, I have to recommend, and if I'm allowed,
Please.
you have to try Satcher Health Leadership Institute Community Health Leadership Program. If you go to the Morehouse School of Medicine website, just punch in Community Health Leadership Program and it'll come up. There's an application, but it changed my life.
And it's free.
And it's free.
Hello.
And at the time they would give you, some funds to actually put in your own pocket towards your own organization.
Right.
But the beauty of it was that it allowed me to see my community from a different perspective. Many community-based organizations will tell you what you need as a
Right.
community.
Right.
And Satcher Health Leadership Institute and the Community Health Leadership Program trained us to assess the need of the community and not go into the community telling them what they need.
I love that.
And so we sort of have changed the way that works.
So an example of that would be a food desert. Can you
Yes.
tell me what a food desert is?
Oh my goodness. So if you're not within 1 mile of a grocery store in your community, you live in a food desert. If your community is surrounded by just convenience stores that don't sell fresh
Produce,
fruits and vegetables,
healthy meals.
Yes, you're in a food desert. So most of Atlanta is pretty much a food desert. And so if you're not within like a good mile of a super Walmart or any grocery store that sells fresh fruits and vegetables, you're in an at-risk community, and it's called or termed as a food desert.
And there are many other terms
Yes.
that you can find out more about, but I think that is major, because going back now to a community that doesn't have access, that affects your health.
Yeah.
It affects the health of your unborn children. It affects your personality. And you wonder now why we felt the new name, which is what? Underserved.
Under-resourced.
Or under-resourced is better than underserved. See, I've got to get used to the new name. But this is why it's so important to recognize just the little things that most people don't even have a problem with, because you can jump in your car and drive 10 miles if you need to, but someone with a disability or who doesn't have a vehicle would have to walk.
Yeah.
So, as we close out, and this is so hard for me to do because you have so much more going on, what in the world is an UDPAG? UDPAG. UDPAG?
UDPAG.
Okay.
So, the Union of Disability Professionals and Advocacy Guild is founded by leadership that came out of the Centers for Leadership and Disability, CAC, and a program called My Voice, My Participation, My Board.
Funded by which university?
Centers for Georgia State University.
Yes.
So we're all, or I'm also a participant. I serve on the board for the Community Advisory Council for Georgia State Centers for Leadership and Disability. And as community people, because my brain automatically goes back to the community.
Always, yes.
We needed to have something that represented us. We needed to be able to control data and information. And a lot of times, because of my experience in community engagement, institutions are often famous for going into the community and doing a survey, and then they abstract the information and then they never share it with the community.
Right.
The Union of Disability Professionals for Persons with Disabilities in Georgia was designed that we would have control over our own data as it relates to our communities. We are currently surveying communities all throughout the state of Georgia,
Yes.
utilizing a survey that did come out of Morehouse School of Medicine by Dr. Aileen Booker, PhD. She's a member of the Satcher Health Leadership Institute team, and we use the windshield survey to survey the entire state and at-risk communities and communities throughout the entire state of Georgia. We want to be able to identify what are the needs of people who are living here in Georgia, and what are they lacking. So if you're living in a community that doesn't have sidewalks or green space, doesn't have an active hospital, you don't know where your nearest police department is as a person with a disability. We want to extract that information, but we want to control it as community people versus an institution.
Right.
And that's a powerful difference between owning your own information as a community and using it to educate others and empowering others throughout the state.
And it's being disseminated in the very communities where the information was extracted. And the difference is, you may not know you live in a food desert. You may not know what you don't know. But you have community activists and community leadership and champions such as Dr. Hopkins that knows exactly what to do with the information to extract the information you need now to plan your own future and pick your own zip code. What's amazing about the windshield survey, which came out of Morehouse, is that it was modified so that it can be taken by the community, not just of the community. So the windshield survey was absolutely the foundation and the platform, but it's been modified and created in such a way that the actual individual, whether with a disability or otherwise, can take their own surveys, recognizing throughout that, wait a minute, I don't have these things. So it's also an education platform.
Yes.
So tell us who the chairman of your UDPAG is. Or chairperson.
Your chairperson is
Me.
My role is I didn't want to be the chairperson, and I specifically said to the group that's responsible for the Union of Disability Professionals that I didn't want to be the chairperson. Did I have something to do with it coming together? Yes, but I have so many other different responsibilities and leadership roles, both locally and nationally, and I thought this is something that I would like for someone else to sort of lead off on and let this grow in the community and empower and strengthen our state as it relates to disabilities.
And thank you for choosing me. It was a selection process, so I'm honored. And we are being supported by Georgia State University. We're out of time.
It was a pleasure.
The pleasure was all mine, and for each and every one of you, I'm sure I'll hear the same. But on our show, what we do is we close out with a D-Life Diamond. So very quickly, in the remaining seconds we have, tell me the outtake. What is the gem, the jewel that you would like to leave with the Disability Life TV viewers? What is your D-Life Diamond of the day? Just one thing.
That we are not broken as persons with disabilities. That we do things as other people do. We can work, we can play, we can live. We strengthen. We are business owners, we're politicians, we're leaders, we're strong, there are many of us, we vote, we are very responsible, and we're growing, and I do see a new future, a new horizon as it relates to people who are living with developmental disabilities in Georgia.
That was awesome.
Yeah.
I didn't even pay him to say that. Thank you for joining us on Disability Life TV on the BizLinks TV network. We look forward to seeing you again soon. We love you for watching, and God bless.